How to take care of dengue fever platelet count. Dengue fever platelet count. How to increase. In the period of time when millions are left suffering from dengue fever, there are many ways of fighting against this condition. It's been known to leave people with immunity that can't stand against the dangerous virus. But there are several ways of how to increase your platelet count if you are affected by this infection. Increasing your blood is a way of going through the required steps to cure yourself. This is something that needs to be done because every individual requires an increased number of platelets. Although there is a vaccine available for preventing dengue fever, it does not exist for those who have suffered from this infection. Some would need to continue on with another course of treatment to add strength to their immune system. For those who are immune deficient, it is essential to be more concerned about boosting your immune system. This is actually the fastest and easiest way to do so. It's essential to know that the mind cannot fight against the body's immunity as well as the body could. A person needs to take into consideration on how to improve the immune system when he or she has to deal with this infection. One of the best methods to increase your platelet count is to increase your intake of iron. In doing so, you are going to get rid of the bad substances that cause the platelets to be lower. Iron is needed in the body to help with the absorption of calcium. With this, you can add strength to your body to fight the infection that attacks the body. The iron that you get from meat is known to increase the amount of calcium you need to absorb. With this, you will have a better time fighting against the dengue fever. If you find out that you are infected with dengue fever, it is a good idea to start eating more meat. This is going to provide you with a boost in taking care of the need for some additional amounts of iron. When you are able to see that you are not getting any help in having a higher platelet count, you should also look for other options. You may choose to go in for a prescription. These are things that are applied for a time so that they can help you get the best possible treatment you need. There are several reasons why these work well. The medicines are safe and will not bring harm to your body. They are also effective in treating the problems that occur after one has been infected with dengue fever. What is the importance of a normal dengue fever platelet count? The platelet count is usually used in patients with dengue fever. Platelets are blood cells, which help the body to form a blood clot. The platelets help in the blood clotting process. Platelets are also important for platelet production. When you are infected with dengue fever, your body produces a high amount of platelets. This can be seen on your platelet count. Your platelet count may be very high, but it can also be normal. When you have a low platelet count, this can cause bleeding. When your platelet count is low, it will have a greater chance of clotting during the time of an outbreak. An outbreak can be the difference between surviving and dying. Also, it can help to slow down the spread of the disease. Unfortunately, not all areas in the world are protected from dengue fever. A low platelet count is also an indicator that you may have been exposed to the disease before, but it may be too late to protect you. A platelet count may not always tell the whole story when it comes to dengue fever. Because of the size of the bloss, it is a rough estimate and not as definitive as a lab test would be. To help protect yourself from getting dengue, consider these things. If you are pregnant, choose to be treated before delivery, prenatal, and if you are planning to become pregnant, stay out of the incubation period. If you contract dengue, your child is at risk of being born with an abnormally low platelet count. Therefore, it is best to avoid catching dengue if you do not plan to become pregnant. If you are a breastfeeding mother, it is best to avoid exposure to infected people and pets if you think you may have dengue fever. Unless you plan to breastfeed, it is best to avoid contact with people or animals who are infected. This can help reduce the risk of transmitting the disease to your baby. If you are working in an environment where you could come into contact with other infected people, consider using precautions. Clean up after yourself so that you don't spread the infection to others. Get vaccinated if you can. A dengue fever platelet count is an excellent indication that you may be infected with dengue. However, it should be noted that not every case of dengue requires testing. In some cases, symptoms may be mild or nonspecific, and the patient will likely only require a simple blood test. If you are unsure about your dengue fever platelet count, you should contact your doctor. Doctors are trained to diagnose and treat dengue fever. For more information, you can visit the International Dengue Fever Society website. If you are diagnosed with dengue, it is important to note that there may be other factors that may cause abnormal results on the test. Other things that may be involved are dehydration, high or low iron levels, renal disease, or inflammation of the liver. Getting a doctor to get your dengue fever blood platelet count might be difficult. Sometimes, it is just not that easy to get someone to measure your blood. However, that doesn't mean you can't try. You should have a dengue fever blood platelet count if you are getting frequent and painful bouts of severe pain in your upper arm, calf, or elbow. These are the classic signs of the illness. If you are consistently having trouble moving around with these problems, you should make an appointment with your doctor. Your doctor will probably want to see your blood. Dengue fever is caused by a virus called Dengue. This is another name for the dengue virus. The virus is transmitted through mosquito bites, so keeping yourself protected from mosquitoes is essential. We do know that you are more likely to get dengue if you have not had your annual vaccine for this year, so getting a vaccination for next year is a good idea. But if you are already up to date on your regular dengue vaccine, this is not going to help you, because you won't have protection for the year to come. Therefore, you will need to get a dengue fever blood platelet count. If you have missed more than a couple of doses, you should talk to your doctor about getting a booster shot. You may need one if you have had an allergic reaction to the vaccine or if you have missed more than a couple of doses. The number of times you need to be vaccinated for this is based on how often you have missed doses of the vaccine, so it is important to ask your doctor about your need. If you have never had a dose of the dengue fever vaccine, you should talk to your doctor before getting a second dose. In general, it is best to get 2 doses, but if you have a medical condition that makes it hard for you to tolerate the pain of getting a shot, you should skip getting 1 dose. Some people are not able to tolerate getting a shot. For these people, getting a lower dose might be the best option. If you have missed doses of the regular dengue vaccine and it is past time for you to get one, you should follow the recommended guidelines for getting the vaccine for the given year. The doctor who gave you the first dose should continue to give you the second dose, too. The doctor should monitor your progress every few weeks to make sure your body is getting ready for the vaccine. Some doctors will schedule a visit for you at least once a month to make sure your body is responding properly. If you are using contraceptives or birth control pills, the doctor may want to check in on you to make sure you are okay using them. When you get your blood taken, you should talk to your healthcare provider about the procedure and how you feel after it. There are a lot of people who experience pain or swelling in the area where the blood is taken. This is usually temporary and will go away in a day or two. The cost of blood is also not cheap. You can expect to pay about $50 for a couple of hundred units. This is how much the blood will cost you if you get 2 consecutive dengue fever blood platelet counts. It will probably cost about the same price to have 2 consecutive malaria blood tests. You can also get a credit card from your insurance company for your blood if you have to get blood drawn frequently for tests. This will make things easier, especially if you have insurance, but if you do not, you should be able to find out where you can get blood samples for your research. Foods to increase platelet count in dengue fever. Drinking plenty of water is very important for overall health, and drinking cold drinks is a great help. Second, it may make the blood and other fluids colder, so your dengue fever symptoms will not be as bad. Third, it decreases the problems caused by toxins in your blood, the cause of most dengue fever symptoms. And lastly, cold water is a great source of electrolytes. Natural vitamin B complex is the B vitamin that is often recommended to fight off colds and flu. Now, what about supplements? If you are seeking a natural way to increase your platelet count, then these vitamins may be a better choice. Another good option for foods to increase platelet count in dengue fever is pumpkin seeds. This is a common ingredient in several products and is not regulated in some countries. Do not ingest this product if you are allergic to nuts or peanuts. There are many such healthy foods and supplements available to those who are looking to get healthy. They are usually cheaper and more affordable than prescription medications. So they are a great alternative for anyone who suffers from dengue fever and wants to improve their chances of surviving the virus. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.